I'd like to welcome our two speakers for the Preventive Care and Overcoming Health Barriers panel. First, we have Margaret Okodua. She is Nigerian American. She is a licensed professional registered nurse, licensed advanced practice nurse, certified nurse practitioner, and board certified family nurse practitioner. She is a member of the Nigerian Nurses Association, as well as the National Association of Nigerian Nurses, and she is passionate about working with community health in the African community. She will be speaking about preventive care today. After, we'd like to welcome Yaw Peprah. He is a Ghanaian-born immigrant, and he has his master's degree in public health from DePaul University. He has spent a lot of time working on health in the African immigrant community in Illinois, and he is currently working at the University of Chicago's Comprehensive Cancer Center in both the Office of Community Engagement, Cancer Disparity, and the Cancer Prevention and Epidemiology Center. He will be speaking about hepatitis today. So let's welcome Margaret to the podium.
Good morning. So we'll be discussing about preventive care, and what we'll be looking at is to understand the importance of preventive care in our community, African community, look at the barriers that are accountable for not seeking health care, the factors that influence the decisions that we make regarding our preventive care, and what we should do to improve on that. So the focus of the preventive care we are going to talk about will be hypertension and diabetes. So what is hypertension? I will start with hypertension. If you look at your right, you look at your left, or think about your family members, you will know at least one person in our community who has high blood pressure or hypertension. And so, whether we like it or not, we are at risk of developing hypertension. So hypertension is an increase in blood pressure that is above about 140 or greater than 140 on the systolic blood pressure, which blood pressure has upper one and lower one. The upper is called systolic. Whenever it's up to 140 or greater, you have high blood pressure. If we take that 3 consecutive times, say at 3 visits, we will diagnose you with hypertension. Same thing with the lower one, which is the diastolic pressure. That one, when it's 90 or greater, we also consider you having a high blood pressure. So, and what is the higher one and the upper one? When your heart contracts, the level at which your blood pressure is measured is what we call the systolic. And when your heart relaxes, and we take it again, whatever that pressure is your diastolic pressure. So that is a quick definition of high blood pressure. And in our community, there are so many myths about hypertension. I'm not going to read all of them, but you can look at it on the screen. People have different reasons to tell you that they don't have hypertension. Some will tell you, oh, because salt can affect your blood pressure. People will tell you, oh, I don't use table salt, I don't do any of this. But table salt really is not your risk factor. Your risk factors are different from that. So you can see, these are myths listed by American Heart Association. For the sake of time, I'm not going to go through each of them. What are the symptoms of hypertension? Hypertension truly really has no symptoms. And that is why we call hypertension a silent killer. You can have hypertension for a long time without knowing it. By the time you actually feel anything, it may be really getting worse. But we are, in our community, we are to some extent blessed because some of us can have certain symptoms when you have hypertension, such as headache, dizziness, maybe shortness of breath, that's not so common. You may have chest pain. You may have a palpitation when your heart starts beating fast. And some people may even have a nosebleed. What do you do when you have nosebleed? You wipe it off, you raise your head up, and things like that, you think you are okay. Sometimes you don't follow up with your provider to see why you are actually having nosebleed. There can be other underlying cause for nosebleed. So why is high blood pressure dangerous? Well, high blood pressure is supposed to occur when your age is getting higher, like when you're getting older. But in our community, in African community or African American community, it's not with higher age. That don't work for us. You can be young in African community and still have high blood pressure. And often, when we have high blood pressure, it's more severe in our community. And I think I already touched the third one. And when we receive treatment with high blood pressure, we are also on the lucky side when you compare us to the Caucasians. We are likely to reach a control level or target level for treatment when we receive treatment. So that means we get a better effect than the Caucasian community. The one that is really of interest to me is the last one. When we have high blood pressure and the other groups, like the Caucasians, have high blood pressure, we are likely to die faster with high blood pressure than the Caucasians. So we continue with the reasons why they are dangerous. When blood pressure gets to certain level or continuously remain at high level, it affects our hearts. It makes our heart work harder, and so what happens is the left side of our heart start getting enlarged, which we call the left ventricular hypertrophy. And when you have that, when it gets larger, the muscles of your heart becomes weaker, and so we are setting ourselves up for heart failure. It can also affect our blood vessels, our kidneys. Our kidneys also tend to work harder because kidneys and the heart have relationship. The kidney supply the blood that goes to the heart. And if we have high blood pressure, the kidney also works harder to keep this balance between the heart trying to regulate the blood pressure and the kidney producing our blood. So I look at the World Health Organization's statistics on the proportion of Blacks, Africans dying from cardiovascular disease. This is not just about high blood pressure. Cardiovascular includes your blood pressure, diabetes, obesity, and other works. And again, when blood pressure tends to remain high and put pressure on our blood vessels, it can lead to what we call aneurysm, because your blood pressure expands, and so your blood can all of a sudden drop. And if it does that, you can have aneurysm of the brain. You've heard people suddenly fall and drop dead. And I think one of the most popular person I've heard of was, what's his name? Quincy Jones once had a brain aneurysm, but he was lucky. Some people are not lucky. If you have brain aneurysm before you get to the hospital, you may not make it. So that is one of the reasons we must control our blood pressure. Another thing is, okay, I already touched that of the kidneys. So what are the risks? What put us at risk for high blood pressure? What are the things that we actually have control over? smoke, tobacco. Tobacco in any way does not help our health. It does not matter. The only thing you enjoy out of tobacco is the sensation because you are the one who smoke it. But if you take that away, tobacco is devastating to every single nerve, every single part of our body. Food. The food that we put in our mouth, we are in control of it. If we put unhealthy food in our mouth, we will bear the consequences. In our community, we love frying food, and that does not help our health. Alcohol. Alcohol is not supposed to be devastating to us. But when we abuse alcohol, it becomes devastating to our body. One of the myths was, I heard that wine helps the heart. Yes, of course it does, if you take it in moderation. When you abuse alcohol, it destroys your body. It can even make your blood pressure go higher. Obesity. Previously in Africa, we used to be so skinny. People would think we have no food to eat. It's not because we didn't have food to eat. It's because we were very active. We would go to the farm, walk miles, go to school. There were no cars. If you have bicycle, you were the rich among the poor. So what is going on today? Almost everybody has a car. If you have to move from here to there, you want to jump in the elevator. We are no longer active. So obesity is one of the biggest problems to our cardiovascular health. So again, let's think about activities. Exposure to persistent stress. Unfortunately, America brings about stress. Whether it's your job, relationship, children, because if you think about African community back home, we have extended family. You didn't have to look for nanny. When you have 10 or 12, that's why people could have 100 children. You have neighbors to take care of your children. You didn't have to bear that stress. You didn't have to bear that body. As a woman, yours was to give birth to the child. The rest was left for the community. But here, what happens? If you have 4 children, that's a big budget. By the time you pay your nanny $200 a week for one child and you have 6 children, that's $1,200. Do you make $1,200 a week? So now you're stressing yourself out. How do you take care of your children, balance your job, take care of your household? So all those things, transportation, all those things add stress to our health. Cholesterol. High cholesterol is also devastating to our health. So, the food that we eat contribute to high cholesterol. But unfortunately, as Africans, when we get to a certain age, our livers start producing cholesterol. So even if you eat the most healthiest food, you will still have a certain level of cholesterol. So that means the only way you can actually control it is control what you put in your mouth. That anything you have control over, take action about those. Diabetes is another one, so we'll move on because we will talk about diabetes. I hope I have enough time. I think I'm seeing some flashes. So what can we do to prevent hypertension? First is to check your blood pressure. Those blood pressure machines are cheap now. Even if you don't have money, you can walk into Walgreens, Target, Walmart. They have those things all over. Fire department, they are open for you. It's a public service. You can walk into any fire department and say, I want to check my blood pressure. And they will check it for you with no questions asked. 2, seek healthcare advice from a provider. If you don't have health insurance, thank God we have Obamacare now. If you haven't signed up for it, remember, sign up for it. Everyone can get Obamacare. Lifestyle changes, stop smoking, stop drinking alcohol, meditate. Anything you can do to reduce your stress, work on that. Medication. Medication, let it be our last resort. That will be the decision of your healthcare provider. And when the healthcare provider tells you you have to take your medicine, take it as prescribed. Don't take it today and forget it tomorrow. Every day is important when you take your medicine. You don't take it, your blood pressure can go up at any time. And when blood pressure spike up because stress can affect it and other things, stroke can occur. We don't want to see stroke in our community because it's devastating to go through rehabilitation when you have stroke. So I will quickly touch diabetes. So what is diabetes? Diabetes is, or what is responsible for diabetes? The pancreas produces insulin, which is responsible for controlling our blood sugar. So sometimes the people's pancreas cannot do that. That is responsible for diabetes type 1. Then we have people who have insulin, but insulin is not able to circulate in their body to control the blood sugar. That is why we have type 2 diabetes. And we have the third one, which is gestational diabetes, that is based on pregnancy. But I will touch type 2 diabetes. So these are the myths about type 2 diabetes. I'm out of time. How do you know you have it? Sometimes you're urinating a lot, you're thirsty all the time, you're drinking water, you're hungry most of the time, you have a problem with your eyes sometimes. That is when it's getting worse. Initially, it doesn't affect your eyes, but diabetes affects every part of your body. Why is it dangerous? Diabetes damages the heart just like the blood pressure. It destroys your blood vessels. It affects your eyes, like I said, every part of your body. It can shut your kidneys down to the extent that you have to be on dialysis. It messes with your nerves. You can't even feel nothing to some extent. It affects your circulation to the extent that they may have to cut your leg if you don't control your diabetes. Remember, prevention of diabetes, maintain good body weight, exercise at least 30 minutes a day, eat healthy food, lots of vegetables and fruits, avoid tobacco. Did I hit the time?
Thank you so much, Margaret, for sharing that great information with us. Remember, if you have questions for Margaret that came up during her presentation, you can be writing them on the card, and the ushers will come around and collect them, and we'll try to get to those at the end. Now we'd like to welcome Yaw Peprah, our next speaker, up to the podium to talk about hepatitis in the African community.
Thank you. Okay. Hello, everyone. My name is Yaw Peprah, and I'd like to thank Margaret for such an enlightening presentation. I also would like to thank the United African Organization for this opportunity to talk to my people, as I call it, about hepatitis and why you should care. I'm no stranger to United African Organization. Actually, I've been mentored a lot by Ali Kaba, and he's been a very great influence on my life. And so every opportunity that I get, I'd like to thank him for what he does. And so thank you. So hepatitis and why you should care as a African immigrant. And so we'll talk about what hepatitis is, the different kinds, and where we stand as African immigrants in the state of Illinois and even in the United States, and also the ways to protect yourself. First, hepatitis, what is it? It's a disease that is caused by a virus that can damage your liver. And the liver is one of the most vital organs in our body that makes lots of proteins and vitamins and produces hormones. But it's also responsible for cleaning your blood and also storing energy and many others that goes on in our bodies. And so I don't think the liver is an organ that we want to take for granted. You know? And so I'll differentiate between acute and chronic hepatitis, and then I'll tell you about the different kinds of hepatitis. We'll talk about A, B, and C, and today I'll focus mostly on B and sometimes on C. And so acute hepatitis is the inflammation of the liver that lasts less than 6 months. And so with this kind of hepatitis, acute hepatitis, you can have a lot of the various symptoms that I have listed on this human body. And so yellowing of the eyes, you can also experience stomach pain, joint pain, dark urine. You may not have the best appetite, and also nausea and vomiting. But one that stands out the most is you will feel that you're constantly tired and you feel weak in your body. And so this is what is termed as acute hepatitis. Now, chronic hepatitis is inflammation of the liver that lasts more than 6 months. So acute is less than 6 months, and chronic is more than 6 months. I'll get to the no symptoms part very shortly. So hepatitis A, it has various means of spreading from person to person, and it could also spread through personal contact with someone who has hepatitis A. The virus enters the body through the mouth, or it can be in your food, it can be in your water, or in your hands. When your hands come in contact with human waste. And so that contains the virus. There are various means by which you can catch hepatitis A. And in the end, I'll show you a very short video that tells you how easy it is to get hepatitis A. Okay. And so hepatitis B and C, the means of transmission can be through from mother to child, and so pregnant women can, if they have hepatitis, can easily pass it on to their children. But also, when you look on the right side of the screen, you can see razors and needles, and so those of us getting tattoos or shaving with different kinds of sticks. I even go to the extent of telling my barber to sterilize his material so I can look at it before you put it on my skin. Also, unprotected sex or contact with someone that has the hepatitis B virus can also lead to transmission. And coming in contact with infected fluids, and so someone may cut themselves and you don't have gloves on, or you're not protected, and you come in contact with those fluids, and if the person has a hepatitis B virus, it could easily be transferable, as well as blood transfusion and organ transplant. So hepatitis B and C, the scary thing is that it has no symptoms. So you cannot say that I'm feeling dizzy, or I have a rash on my neck, or you name the many symptoms that we know from the various illnesses that are around. A person with chronic hepatitis may not feel any pain, so you don't have anything bearing on you that would demonstrate that maybe this is what is happening. That's why it's dangerous, and it's a silent killer. And so almost 40% of the people with the virus don't even know that they were infected, and to me, that's troubling. And it all goes back to what Margaret spoke about, in getting yourself checked out constantly and regularly to make sure that the things that we have control over, we're able to take matters into our own hands and protect ourselves. And so many people start showing symptoms when it's too late, when it has already affected your liver and is damaging your liver. That's when we run into our doctors and our primary care physicians to seek medical advice. But really, and so with all other illnesses, if you catch it early, it's much better. Your chances are much higher. And so I think keep in mind that this is something that doesn't have any clear symptoms that you could look for. Okay. So why is this important to us? This is very important to me and to my African immigrant community and to the African American communities here, as well as the larger American country, because 1 in 4 people, when you take 4 people, I don't want to scare you, but if you look around and you count 1, 2, 3, 4, 1 in 4 people with chronic hepatitis will develop serious liver disease. Now, at that point, it's is very scary. And so we don't even want to allow hepatitis to take us to that extent where we'll have that serious liver disease. And also, Black adults have 2 to 3 times the rates of hepatitis B as their white counterparts. And so I think that's pretty straightforward. We know where we rank. And to take it even a step further, do we happen to have a pointer? Okay. So when you look at let's see if I have the mouse here. Okay, so when you look at the map here of the world, so I'll focus on the dark green, which is this part, these parts. These are the areas where prevalence of hepatitis B is 8% or greater. And I'm sure we all know where we are, Sub-Saharan Africa. We're literally painted in total dark green, and so it tells something about where we're coming from. And now we're here. We're here. We may not have gotten ourselves checked out while we were back in our respective African countries, but we're here. We have the resources, and the highest rates of hepatitis are found in this region of Sub-Saharan Africa that I just pointed to from here down. And so it literally means that we are at risk just by virtue of where we came from. And if you're here, it doesn't mean that you're escaping all of the illnesses, including hepatitis B, that you may be vulnerable to. So these are the dangers. This is why this is so dangerous. It is 100 times more infectious than the HIV AIDS virus. I'll let that sink in for a second, and then I'll repeat it. It's 100 times more infectious than the AIDS virus. Okay, we get very afraid when we talk about HIV and AIDS, and yes, we should be afraid, and yes, we should get ourselves checked out. But while we're focusing all of our attention on HIV and AIDS, you should know that there's something that's literally lingering right around the corner that is 100 times more dangerous than what we have our attention focused on. And it can be done at the same time as far as getting yourself checked out for hepatitis and also for HIV and AIDS. Okay, so what do you do when you leave this auditorium? Before, that should be before, not when. Before you leave here, we have had, we're privileged to have one of the most reputable community organizations here with us, which is the Asian Health Coalition, which I've worked with on this hepatitis screening some years back. And they will be right here signing folks up to get tested for hepatitis. And so there'll be a screening literally set up outside for you to be able to get yourself checked out. Now, there's nothing for you to be afraid of, I should say. It's literally there's a lot of privacy. You're put to the side. You get your blood drawn. I understand people get a little iffy about getting your blood drawn. Again, as far as my job is concerned, I've been drawing blood from various kinds of people, and I can't say nothing other than there's nothing for you to be afraid of. There are people in here that I know, I recall seeing them from the previous screenings that occurred. It's a matter of just going in, answering a few short questions, getting very small amount of blood drawn from you. And what they do best is they get back to you. United African Organization provides the education, and then they provide the screening, and then they provide follow-up from Asian Health Coalition, which is something I think we should be very proud of. And so after getting tested, you'll be reached out to, and the vaccination, you need 3 shots over 6 months. And so all of that will be set up for you through the Asian Health Coalition. And you cannot get hepatitis B from these shots. Please, I want to make that as clear as possible, okay? And so I think we have, hopefully this link works.
as many as 5,000 people, could have been exposed to hepatitis A at a Red Robin restaurant. I gotta tell you, this Red Robin restaurant in Missouri, any number of people could have been through there. Talk to us about how this exposure could have happened.
Well, what they found was simply you had an employee there who had hepatitis A and was actively contagious.
To their knowledge, did they know?
They did not know at the time. They found out after the fact. The person continued to work there. They're not saying in which part of the restaurant they specifically worked, but that's concerning. Hepatitis A is pretty contagious, and was this person dealing with food specifically or utensils that were dealing with food? They're not saying that, but they're saying basically anybody who was in that Red Robin restaurant during that time period, it could potentially be infected. Now, it's a low likelihood.
A low likelihood?
That they will actually get it that way, but they got to be sure, and that's why they're notifying these 5,000 people.
So they test them, then what happens?
Well, if you could take a prophylaxis, a vaccine essentially, even after 2 weeks after an exposure. So if they get people within that time period, they could potentially be protected. A lot of people get the hepatitis A vaccine. You may have gotten it, I've gotten it just because of travel, so those people would obviously already have protection. But for younger people, older people, people who have weakened immune systems, that's going to be a real concern. They got to go there, test them. If they're within the window still, that 2-week window, give them the prophylaxis. Otherwise, they got to watch them and see if they develop any symptoms.
Okay, so as you can see, it's literally a matter of walking into a restaurant. That's how easy it is, and I wouldn't pass up on the opportunity to get screened here while we're here. So a few things to remember before we leave here. One, hepatitis can make you very sick or even die. Hepatitis B and C virus enters the body through contaminated blood and other fluids. There are also various means through which it enters the body, and us African immigrants are at higher risk of hepatitis here in America, and so I would plead with you to get screened for hepatitis B and C, and also protect yourself at all times by getting the 3 shots, and always practice good hygiene. And I can't emphasize enough to keep washing your hands. Okay, so thank you.
Thank you, Yaw, so much for that presentation. And remember, if you have any questions, please pass your cards to the aisles or raise your hand so that we can have our speakers answer the questions that you may have. So again, I just want to remind you, like Yaw said, as soon as you leave the auditorium, you can sign up for hepatitis B and C screenings that will be done here this afternoon in partnership with Asian Health Coalition. It's completely free. Like he said, there's not much to worry about. It's really good to know what your hepatitis status is. And then after you do the screening, we can help connect you to vaccines or treatment if necessary. Okay. So I think this first question is for Margaret. Given your professional experience, can you talk to us a little bit about the claim of natural healthy hypertension cures that are offered through the internet or even TV? Do you think natural cures are valid and endorsed, or what would be the best ways to deal with hypertension?
I'm a public health professional, and those things that I mentioned earlier, exercise, healthy diet, your medication. We know that alternative medicine exists. I'm not saying they are not therapeutic. I will not recommend or say I'm against it, but I stand by the ones I presented.
Okay, this next question is about blood sugar and blood pressure. So can we talk a little bit about the importance of controlling one's blood sugar and blood pressure, especially given the link to kidney failure in persons of color? Okay, the importance of controlling your blood sugar and blood pressure, and what is the link of blood sugar and blood pressure control to kidney failure?
The the answer to that is it varies. It depends on your underlying conditions, or what we call comorbidity, meaning you have very different chronic diseases. If you just have high blood pressure, it is chronic. It's not going to go away without those things we tell you. If you exercise, if you control your weight to the weight that is recommended for your height, and you eat healthy diets, you modify your lifestyle, you are likely to get off high blood pressure medication. For diabetes, if depending on the diabetes you have, if it's the one that the pancreas has problem producing insulin, you are going to be on insulin for life. That's the one we call childhood or juvenile diabetes. But if you are type 2 diabetic, if you control your weight to the recommended age, weight and height, and you maintain your diets, you eat healthy diet, and you and you take your medication to some extent, what happens is your provider can modify your medication. At some point, your provider can actually take you off the medication if you're able to actually control your weight and diet. So it's not about 1 year, 2 years. That's why they're called chronic diseases. But you can move from being diabetic to become non-diabetic. I have my mother-in-law who was about 300 pounds when she was here, and when she was told that, she may not live to see her grandchildren, she modified her life, everything. She's no longer on medication today. I don't know how they do it in Africa, but she's in Nigeria, and she was eating some green papaya and all this stuff, plantain, fufu, and all those stuff. Today, she's not on medication. I don't know how it happened, but it did happen.
Thank you. The next question that we have is, you both talked about a number of conditions that often present no symptoms. So if someone doesn't have any symptoms, why should they go to the doctor? How often should they go to the doctor, and what should they say to their doctor to get checked for these conditions?
Again, I'm speaking from public health perspective. Prevention is the backbone of public health. So I know in our healthcare system in Africa, what we have is treatment system, not preventive system, and that is what we are trying to promote, preventive system. You don't have to be sick to see your doctor. It's called managed care and all those stuff. You can go to your doctor and say, I'm here for my annual checkup. Depending on your age, the doctor knows exactly what kind of screening they need to do for you. If you are a man, for example, and you are 50 years and above, the doctor knows you need to check your blood pressure, you need to have your comprehensive metabolic panel, they know they have to do your PSA for your prostatic cancer screening, and if you're a woman, the doctor knows you have to have mammogram done, you have to have your cervical cancer screening annually, your pap smear. So it's not you that determines that, it's your provider. That is what they are preparing for.
Thank you, Margaret. The next question is for Yaw. Why does someone have to get 3 shots to complete the hepatitis vaccine? Why isn't it just one like other shots? What's the importance of actually doing all 3 shots? Yaw.
So the recommended doses for hepatitis for the screening is 3 shots, and the reason is that, and you have to get them in order, and I believe it's in a 3-month increment, and so it's not one shot because each dosage of the shot does a different thing and prepares you to move on to the next stage. Okay, so you want to make sure that you get all 3 doses to make sure that you're effectively protected against the hepatitis B virus. Okay.
sorry. I know he also spoke about hepatitis A. So, not only do you want to get the hepatitis B vaccine, which are the 3 doses, you do want to get the hepatitis A, which is 2 doses. You get one, and 6 months later, you get the second one. Especially those of us, when you're traveling to Africa, we do eat food. We know people are not so hygienic. You want to get those vaccines. Those 2 covers you for life. You don't have to worry again. 2 vaccines, and that's for the food.
Okay. This question is for Margaret. Why is it that high blood pressure is so common in the African and African American community? Is there a particular reason? Is it lifestyle? Can you discuss that a little bit?
Okay, I thought I touched that before. It's because it's genetic. Because we are Black. That's the first thing. And we have no control over that being Black. So we thank God we are Black. So, the other one is, because we are Black, the way salt is metabolized in our body too is different from the way it's metabolized in other races. So that is why this salt issue always comes in contest when American Heart Association is discussing blood pressure control and high blood pressure.
Thank you both. A number of you asked how you can get the presentations that both of our speakers did. If you'd like to find me after the presentation in the lobby, I can get your contact information and we can send you the presentation so you can learn a little bit more and have time to go thoroughly through those presentations. Again, thank you for your questions, and thank you so much to Margaret and Yaw for sharing some of their expertise with us today.